됐어, 그냥.
What do you think of the picture? Peaceful, comfortable? You may think so, but accidents can be everywhere. Imagine you went to the beach with your girlfriend. While you were away for a phone call, your girlfriend loses her footing and gets drowned. Fortunately, you were good at swimming, so you were able to save her. But she is unconscious and she's not breathing. What do you think is the basic first aid that you can apply to this situation?
That is CPR. CPR stands for cardiopulmonary resuscitation. CPR is a very simple first aid that can be performed non-professional like us. If you don't know CPR, your girlfriend must be in great danger. So we demonstrate CPR and we give some tips. We give some to you tips for your girlfriend.
When someone is unconscious, he or she might be not breathing or not breathe at all. So when this happens, the blood flow from the heart to the brain stops. And as this happens, the brain loses its activity and the patient gets shocked. The final objective of this CPR, cardiopulmonary resuscitation, is to preserve the blood flow from the heart to brain so that it could preserve the brain in activity, so that when the patient recovers consciousness, the patient would receive less brain damage. So when this is not performed immediately after accident or too late, the patient will get excessive amount of brain damage and will eventually die. The CPR we're going to introduce you today is the revised version published on 2010.
Before you perform CPR, you must check patient. You check if patient is breathing or not. If he is not breathing, you must call 911. First step to CPR is chest compression. You compress chest above 5 or 6 centimeter, and you hold your hands like this, and press 3 times at the rest of 100 to 120 compressions per minute. Second step is artificial respiration. It is called mouth to mouth.
괜찮아.
When you start, you lift patient's chin and close his nose, and you give patient a deep breath a second 2 times. Next step is a repeat. Repeat step 1 and 2. If he gains consciousness, let him aside to open his airway.
Although this CPR seems like a very simple first aid, there are some precautions that you must be aware of. The first thing is that the ratio of mouth-to-mouth breath to heart compression is 2 to 30 for adults, just like Patrick mentioned. But for children who do not have lung big enough for 30 chest compression, we just apply 15 of chest compression. And for adults, we fold our both hands to compress their chest. But for kids who have weak bone, we just use only one hand.
You can be saver or bystander. Just remember basic step. First step is check patient. Second, chest compression. Third, artificial respiration. First, repeat. Second, then third step. So 5 minutes after accident is very fatal moment.
Thank you for listening to our presentation. Goodbye.